Live on WFLA Now. Feel good and live your best life with Bloom Health Club. Here's Gail Guayardo.
Today, we are talking weight loss and hot new health trends, and who better to do that with than triple board certified medical professional, founder and director of Spectra Wellness Solutions, and lead physician and speaker for Tony Robbins' Life Mastery Health Program, my friend, Dr. Lisa Koche. Dr. Lisa, it's always so great to see you.
So fun to be able to connect anytime we can.
So, Dr. Koche, for people who are not from the Tampa Bay area, if you are from this area, you know her name. She has like a cult following of patients and especially women who are looking to get on a health journey. And I think it's because this is something that you've had your finger on the pulse of for so many years. Before it was like trendy to talk about biohacking, before anything comes on the scene, you know about it. And a lot of it came from just getting your own health on the right journey.
100%. So I like to say I was gifted with being a patient before I became a doctor. And that really is so true in every way. And it keeps coming back to prove that to me. So I never had to get indoctrinated into a certain way of thinking or certain protocols or that traditional system that we are now questioning so much. I was diagnosed at 15 with leukemia, had heart failure from the chemotherapy before I even went to medical school. So went into school in the first place looking for answers, asking questions, and quickly found out that nobody really had the answers. So I had paved my own path, sort of shepherded myself and my patients kind of since the inception of my career.
Because you found out on a personal level what I think that we find out, and while you are a practicing doctor, and with you have a thriving practice, and this isn't against our medical system. I say this again and again and again. It's just kind of the way the wheel is set up. A lot of times the only solution is prescription medication when that's not exactly the answer. So you help get to the root cause of problems.
Absolutely. And they want us to think that a prescription is the only answer. And I like to say I don't throw the baby out with the bathwater. There's incredible things with traditional medicine. I don't think vilifying practitioners and doctors is even warranted. I think it's the system as a whole. And for whatever reason that we have become driven by these sort of larger institutions that have forgotten the patient-doctor beautiful interaction that should occur, or whatever the reasoning behind, we have abandoned ship on so many modalities that really work. So it's my passion to kind of bring them all back together again.
So let's talk about what really works. You come on our globally syndicated health and wellness show, Bloom, that is headquartered here in Tampa, Florida. And you talk about the latest and greatest. And there is such an exciting time now in the world of weight loss.
Never have I been more excited than I am right now. And it's a pretty controversial topic because people are saying a lot of negative things, just as many negative things as positive things about this class of, yes, prescription drugs that actually are working more than I've ever seen for weight loss. They just have to be done correctly.
All right. Yeah. And I do want to introduce, as we are here today, behind the scenes, but also in front of the scenes, is Brody Waddell. He is our digital reporter and lead producer for BloomTampaBay.com. And he's always deep diving into these stories as well. We've worked together before on weight loss stories. And you're right. It is very controversial because, it is working, but maybe there's more that we need to know. So what would be the pros and the cons of this weight loss revolution?
So I would start out by saying that there's never one quick answer. We all know that. We've heard that for an entire search from the beginning of mankind, looking for answers for weight, right? You may be in a different place on your own journey, and something may have worked for you 5 years ago and not work for you today. Taking a drug without changing lifestyle is not going to work long term. So all that kind of goes without saying. The groundwork has to be set. But my frustration as a practitioner working in obesity medicine for over 20 years is I chose to believe my patients and myself, because I saw it on some of my own little bit of weight gain that I had, but the patients weren't eating bonbons in the closet. I mean, these people were actually doing what they were told. They're exercising, they're trying the newest trends. They may lose that same darn 10 pounds or whatever it is, and the set point was just not budging. So that frustration wears on the patient, and eventually they give up and just say, this is how I'm going to be and this is how I'm going to feel. So when these drugs came out, they were originally developed as diabetic medications, and what they found in the studies is that patients were losing significant amounts of weight in addition to controlling their blood sugar. So then they began looking at them for weight loss. So this is a class of drugs, the main one that's known as semaglutide, which comes as Ozempic or Wegovy. That's the drug names that people are most familiar with. And then people started utilizing them specifically for weight loss without fully understanding how the drug works, what to do to mitigate symptomatology, what the risks are of taking the medication. And we're still unraveling a lot of that. Mm-hmm. But I do think when the negativity came out, to just address that first, people are going to lose muscle mass if they lose weight too quickly, if they don't take care of their diet appropriately, if they're not working out, if they're not sleeping. There's always a risk with massive amounts of weight loss. And I have a lot of experience in obesity surgery. So things like gastric bypass, which the same thing was happening. Patients were losing rapid amounts of weight, and it was, in a lot of cases, muscle, which is what you don't want. So that's one of the biggest knocks on these peptide-based, or they're prescription medications that are peptides. And let's just start out, too, by educating people. Peptides are small chains of amino acids. So a protein is greater than 40, a peptide is less than 40. It's a messenger, and it gives a message almost like taking a hormone, but without shutting down your body's own ability to have feedback and to communicate. So they're just sort of waking up signaling that over time, whether it's with the natural aging process or with toxin exposure or with chronic stress or poor diet or medications, we've messed up. That communication has gotten off track. So these peptides help to reset that communication. That's kind of one of the main ways that they work.
Who are these drugs good for?
Well, I think an easy way to know if it's something you should think about is if you pay attention to your fasting blood sugar. So to share my story real briefly, I've been lucky enough never to have a significant weight issue. With some chronic stress in my own history, I went into early menopause, and around that time, I gained about 10 to 15 pounds without really, you couldn't really tell, but I knew. And I'm not one to just take a drive-by drug because my body's been through too much. I know how these, the typical old phentermine and prescription drugs for metabolism work, and they don't work long-term. That's not something I would ever go to personally. I will use them occasionally with the right set of patients who have some specific presentation and symptoms and hunger, overabundance of hunger in the past. But now with the way these work is they work on the insulin receptor, the glucose insulin reaction. And that, from my understanding, can lead to a higher level of blood sugar at rest. So most people think blood sugar, like if you just look at your blood report from Quest or LabCorp, it's not going to flag unless it's over 100. Well, a fasting blood glucose that's truly healthy is probably 85, 75 to 85. And what I did when I noticed that my usual ways of handling a little bit of weight weren't working is I put on what's called a CGM. So I suggest listeners to think about getting that or trying it if you haven't yet, which is a continuous glucose monitor. CGMs, you just stick on your arm and they will give a feedback to your phone. One of my favorite data collecting hacks, where you can check at any time of day. You don't have to stick your finger and see what your sugar's doing. So many people are fasting and many people are doing extreme exercise and having the opposite number, like their sugars are going up. And that was kind of what was happening with me. Mm-hmm. So my fasting blood glucose, in spite of everything I do, as this sort of biohacking doc on, taking my supplements, eating clean, was in the 90s to low 100s, and I couldn't get it down. So I decided that what I had read about this class of medications was going to be interesting to see how my body was going to react to it. So that's one way to know if you're a candidate, is if your fasting blood sugar is consistently staying in the 90s, which historically was not thought to be a problem. It is. If you have tried all different kinds of things or tend to be very carb sensitive, and the typical carbohydrate avoidance, modified keto, sort of higher protein isn't working, that's another incident where you may want to try it. But honestly, most people at this point who are hitting a wall when it comes to inflammation and how their body is reacting from a weight perspective and or blood glucose perspective. You can also check levels of leptin. Leptin is a fat storage hormone that tends to get elevated as these communication pathways are off the rails. And mine was high, which is kind of wild because you wouldn't expect that. So getting with a practitioner, getting those level tested, maybe taking some self-responsibility of wearing the CGM and paying attention to your own numbers, because this is a very individualized thing where your genetic makeup, but also your stress level, your toxic load, your hormonal balance, men and women, are going to be different. So when I go and eat, it could be all healthy carbs, but even if I had sweet potato or a gluten-free cracker, my numbers were going up and not coming back down. Whereas if I ate in the morning, which you would think fasting, I used to do my black coffee or, take or just my shake, my numbers were staying high. And then when I ate something in the morning that was a more balanced, higher protein, they were coming down in response to that. So I think getting those trends, establishing those trends, and then figuring out if this would be something that's worth trying for you, and working with a practitioner, because when it comes to some of the risks, so if you want to go to those, there is a genetic thyroid condition, thyroid cancer. It falls in a category of multiple endocrine neoplasia syndromes, MEN. It's a very rare genetic familial cancer grouping that they did find in rodents only with this class of drugs, an increased incidence of that specific type of thyroid cancer. It has not been found in humans that I know of to this date. So I just make sure there's not a history of this MEN syndrome in a family. If there is, I will avoid the drug. Even with most thyroid cancers, it is not contraindicated. So it's really just that specific class.
But it is important because it's easy to get your hands on this these days. I mean, there are a lot of people offering semaglutide. And from what I understand, it is important to get your blood work done. It is important to have a baseline, and it's important to know who you're getting it from, because not all semaglutide is created equally. It could be compounded. Sometimes it's taken out. They give you the syringes. From what I understand, if they just give you the syringes, maybe that might not be the best. I mean, I don't know. I'm hearing you would know better than I would about just making sure you're going to somebody trusted.
Yeah. Well, with any hot trend, everyone's jumping on the bus. And I think it's really interesting because there's a lot of places that are prescribing or getting it online or whatever way and method people are having to get their hands on this stuff because it's working can be scary. So you're absolutely right. Researching who the practitioner is, that they have experience and that they understand how to prescribe and utilize the drug, and make sure that you're not ordering it online because you really do not know where it's being sourced. We have a couple of different compounding pharmacies we really trust that we get ours through that source. I also have personally found that tirzepatide, which is Mounjaro, which is a second generation of the semaglutide, is working better for my patients with less side effects. So that we've switched most of our patients over to that medication.
I've heard of Mounjaro, so that works well. You're seeing success with that.
With less side effects.
Because the side effects are feeling nauseous, correct?
So patients can have any blend of GI symptomatology. So yes, nausea is probably the most common. There's a small subset that can vomit or have significant diarrhea. Sometimes there's constipation or gut like cramping, because it will slow gastric emptying, which means the whole sort of system will slow down a bit, which is part of why people feel more full. So most of the patients tolerate this if they start it up very slowly. So there's a very specific way to take these medications. And if you just get this from somebody who isn't quite studied up on it, or is, you're getting it online or whatever you're doing, and you start at the therapeutic dose, you're much more likely to have problems. Anything from an inflamed pancreas to pretty severe GI symptoms and complications.
Very interesting. Yeah, I'm so glad you said that, because again, I just want, our viewers and our listeners, this is, so many doctors have come on and say it's the best thing they've seen in the last 3 decades of weight loss. But they also say that you need to be with someone like yourself who's going to look at the blood work, really fine tune it, and know what's best per patient, not just, widely distributing it, because something might work better than, something else. Let's go back to peptides, because you brought that up and I thought that was interesting. You say this is a form of peptides, but you use peptide therapies for many healing modalities, correct?
We do. And it's been like a playground for practitioners. It's like we're in the sandbox with all these new toys. And I'd love to take a second to say that the FDA is actually trying to shut down access to peptides.
That happened during COVID, correct?
Well, during COVID, it was access to COVID therapies.
Right.
And there is a book out called The War on Ivermectin, How One Drug Could Have Helped Save Millions. I would strongly recommend anybody who is interested in learning more read that book. It is now available by a critical care practitioner out of New York. But the FDA seems to be trying to control more of what we are doing than ever before.
But why? I mean, because I will say that there's been this spike in Epstein-Barr. There's so many things that people have been dealing with post-COVID. And the peptide is a solution that is like mind-blowing. I mean, it's peeling people off the couch that, had chronic fatigue, things that their bodies couldn't keep suppressed. Their immune systems are weakened for whatever reason. And peptides seem to help. So why shut that down?
The peptides are helping so many things. Like you name it. It's not just the immune system. It can be everything from people who needed a joint replacement, that their cartilage seems to be more stable, all the way to like we're seeing with the weight or exhaustion, numerous levels. And there are thousands of them. I've had patients with severe depression get off their meds with some of these products. And what the FDA is saying is that they don't believe they've been proven to be safe enough. And they're targeting several of our more effective peptides and saying the injectable is not going to be available by the end of the year. So we are rallying people to send letters in of support so we can potentially get the listeners some access to that a way to voice that they would like access to care. So that's a hot new thing that just happened, unfortunately, over the past week or two that they're stepping in. And
you, as a very trusted physician in this community, why is it, do you think? I remember during COVID, and I was a patient of yours, and you sent out everything that we should have for our immune system before there was a vaccine. You were reaching out to people via email. You were on Facebook. You were educating people. Why do you think that there's censorship of just having doctors being able to tell you other ways to support yourself and support your overall health? Well, unfortunately, it always comes down to money. I honestly, unfortunately, didn't realize how infiltrated the medical system was. I tend to be a rose-colored glasses human, and I love my profession, and I love just helping people see the highest version of themselves and helping them get there. That was my passion for going to medical school. That's still my passion practicing today. But I've been lucky enough to stay out of a conglomerate. I'm on my own, which most doctors are not. So the doctors that are in big conglomerates, they don't have as much freedom as I have had. They are told what they can and cannot do or prescribe.
And this has been the first time almost back to back, like you said, in COVID, and now what they're trying to do here with these new incredible breakthrough therapies, where I am seeing control attempts at control from a governing body that we have never seen before. So you just have to follow usually the trail of the money to figure out why.
That's sad. That's really, really sad. Switching gears a bit, let's talk about other hot health trends that you're sharing with your patients.
Well, I think one is COVID brought to awareness the immune system. And like you said, Epstein-Barr, chronic Epstein-Barr, people that have been exhausted, whether it was from COVID itself or reactions to COVID shots. We've seen a lot of both. We are bringing in some new things like methylene blue. So methylene blue is actually a treatment modality that's been used in labs for a very long time. And as it's been studied more, we see that it has antioxidant, it's oxygenating all of your tissues. It has direct antiviral, antibacterial, antifungal benefits, and it gets activated by light therapy. So we're kind of entering the realm of understanding that the body we have is not just chemical communication and structure, that it actually communicates via energy exchange, and that we have what's called photoreceptors, which are actual receptors on our cells to light. And as we understand things like our fascia, which is the connective tissue that connects all of our organs. So for example, in anatomy, when you are learning about the body in medical school, you're in these cadavers and seeing the organs, but there's this kind of clear tissue around all of them. It's called fascia. And you just want to cut through it to get to the cool stuff. Mm-hmm. Well, we're now understanding fascia is a system in and of itself. So it is a conductive system. And if any of the viewers want to see something pretty cool, you can go on YouTube and just type in live fascia for a video of a surgeon who is in somebody's forearm and blew up what the fascia looks like under very high def microscopes. And it is a hydraulic pump system. So it is pumping water, hydration, and transmitting electrical currents throughout the entire body. So that is going to be something we continue to unwind, because things like methylene blue and light therapy and all these pulsed electromagnetic field therapies and things that are coming out that we know have positive effects may be working through those pathways that are still being uncovered.
That's so interesting. Is that related or correlated to in any way of rolfing? Because I remember when I was in a bad car accident, someone had suggested I find a therapist that could do rolfing, which, by the way, you should look it up. There's not many practitioners, at least here in the Bay Area, or there were not when I was looking. But the release of the fascia and working at the fascia level was like pain relief central. And does the light now work in the way that the manual manipulation of the fascia would work in the form of rolfing?
Rolfing is definitely one way. There are practitioners called myofascial release practitioners, MFR. That's what they focus on. So there's also different types of massage therapists that can get deeper in, or physical therapists that can get deeper into the fascia. But fascial work has another incredible benefit that I've seen, which is it releases emotional trauma. So just like we are starting to understand the fact that light therapy, methylene blue, mitochondrial optimization, all of these different things need energy and light and play with energy and light in ways that we didn't understand, we're also understanding that trauma, and it could be as simple as getting lost when you're 2, all the way to many deeper abuses that many people, and pretty much everyone has traumas of different sorts, can stay as almost like an energetic charge in the fascial system and potentially other places as well. But I had a really impactful experience with it was my second myofascial treatment. And they were going in my lumbar spine and down sort of more into my glutes. And she just did this different types of stretching. It's not painful, but it's not like relaxing like a massage. I'd say somewhere in between. And when I finished and I had some time to process, so I do recommend anybody listening, if you try myofascial or any of these therapies, to give yourself a little bit of space, maybe afterwards to either soak or journal or just be present, because I went for a little bit of a walk on Bayshore and I saw these ducks, and I knew that I was supposed to connect to them because I just was sitting there for a minute, and there was a mommy duck with she had 3 baby ducks and swimming really close to me. And then she swam over the wall and the babies freaked out, like mommy left me. And so I was talking to these ducks. You're going to be okay. Mommy's coming back. And she flew back and they calmed down. And then she flew away again, and I was watching and they were calm. I was like, wow, Mother Nature learns quick. Like, they were okay. They knew she was going to come back. And at first when I saw the duck, I was like, oh, it must be a message. I shouldn't doubt myself. I'm a good mom. Like, even though I've been through all this stuff, I'm a good mom. And then all of a sudden I was like, wait, I only have 2 baby ducks. Right. That is my mom, because I have 2 sisters. And I all of a sudden the memory came in of me at 16 getting these somewhat barbaric procedures that they now put people to sleep for, these bone marrow biopsies. And my mom was not, I didn't know this. I never thought about it. My mom was not allowed in the room. And so this came in, like, she was right outside the door. She came back. You can let this go. And after releasing and just kind of holding space for myself, like, I felt lighter, more clear. And I was just thinking to myself, wow, how many more of these kinds of things? Like, everybody's had something like that. Mm-hmm. How many more can come out? How do we get these things to release? How much can that help your systems, your own peptides, your own electrical communication? Like, how we can operate on this higher level the more we understand some of this additional somatic work / trauma release, in addition to just what we are used to working on.
Very, very interesting. Do you have any questions? I know you do a lot of articles on bloomtampabay.com on trauma.
A lot of stuff with trauma. That's interesting. I wonder if it's almost more putting you in the state of mind for that. I know we're kind of done talking about the peptide thing, but I wanted to ask you, why is it this one in particular that's blowing up so much? Because when I first heard about it, it was probably 4 or 5 years ago for any peptides. And I knew it in the context of the bodybuilders were getting to it. They're kind of always the first ones to try all that sort of stuff. And it was all the nasal sprays and things like that. So why is it only this one sort of taken off?
Beautiful question. And I would say the answer is it's the first in its class to solve a problem that almost everybody has. Mm-hmm. So obesity, such a far-reaching percentage of the population, people knowing more about the recommendations that are across the board and knowing they don't work, whereas maybe the other peptide's a little more nuanced in which category, and there's so many of them. But this, because it's working directly on inflammation, so these peptides, semaglutide, tirzepatide, they're not just cutting cravings, because many people who struggle with weight gain, especially if it's more in the moderate range, 10, 20 pounds, and almost all of us have inflammation who've struggled with that. Nothing is working. So this is having a direct anti-inflammatory effect. We know that. It's suppressing IL-6 and other inflammatory markers directly. It's also protecting your DNA, it's protecting your heart, it's protecting your brain. So there are multiple impact points for this particular class of peptides that are more noticeable, and also with the one thing that people will do anything for, really, which is their weight. So they're more willing to pay for it, to take it when it's not as understood. So by definition, you're having a larger sample number, right, of people that are saying this works, because it does.
And from what I understand, and again, you would know better than I do, there was a big flub in the pharma world where the patent on this particular drug was messed up. It was, the delivery mechanism. So it kind of opened the floodgates as to where more people now have access to it. Because typically a drug like this could take forever to be used off-brand or off-label. So it came to the market with a lot more fever than anybody ever expected, and people are starting to see the benefits. I mean, some doctors even talk about, patients drinking less alcohol on this medication.
100%. So we are seeing people. I had a couple that had broken up, had ended their engagement, and after the partner stopped, was taking this for weight loss, both of them, he stopped drinking, and now they're getting married. So I think that the benefits on the centers for cravings may even blow away the results even with the weight. I mean, it's across the board. There is a more clear thought patterning because the inflammation in the head is down. The craving centers seem to be suppressed. It's as close to sort of a panacea of results that we've seen in the 30 years of, as long as I've been looking for answers for weight loss. And you look at the risk, and I do think in many cases they are also being blown up just as much as they need to be paid attention to. There are many people really going negatively attacking them too. And I always will step back and say, hold on, is this person able to prescribe this? Because very often it's somebody who has a weight loss system or whatever they may be doing, and they're not able to prescribe. So they don't want to lose.
And that's not to say that some of these weight loss systems may work. But to your point, you shouldn't attack something that
and they may work, and we would always prefer that over a drug when we can. But I think used correctly, which means the lowest possible dose, along with a protein forward way of eating. So making sure to get very high amounts of protein, like we're talking 120 grams for most to 150, and men even higher. So high amounts of protein. That if you're doing that along with weights, and what we're doing in our practice is tracking about 35 to 40 patients with grip strength and measuring body fat and muscle mass as they're going through this program. We're looking at their blood work. So we're trying to add to the data pool to be able to do this more safely.
I'm glad you mentioned grip strength, because one of your dear friends who you introduced me to that has become a friend of mine, JJ Virgin, was talking about the loss of grip strength being a real telltale sign that your health is declining. And so the fact that you're focusing on that, and the fact that, I'm so glad you brought up the protein. I mean, these are all things that you hear like here and there, but it all needs to be brought under one umbrella of what people need to do. The blood testing, jumping up the weightlifting, focusing on the proteins. These are all things that can maximize the usage of this class of drugs.
And you would always prefer to not need a drug. So if you can do all of those things, work on the protein. Everybody was on the keto train, and I think people going through a ketogenic diet for about 6 weeks is still very valuable because it teaches people metabolic flexibility, how to run off of carbs or fat. And in either keto or a low carb diet, protein can be in a high number, a high range. So having patients try that first, along with the muscle, the weightlifting and different supplements that are enhancing muscle that we didn't have before. We also have exciting new supplements for muscle mass, for mitochondrial function, that are allowing some people to hit weight loss goals without having to go to the extreme of the medicine. But if the insulin glucose interaction has been damaged, and I do think that's in most people, and it's in a high percentage of people, this can step in. And how long will you have to stay on it? That's going to be something we're going to be tracking. Is there a maintenance dose, potentially once a month or something like that makes sense to prevent the inflammatory reaction from coming back? Those are things we're going to be tracking in our study.
Very interesting. Dr. Lisa Koche, you are brilliant. I always love the opportunity to be able to pick your brain, not just on a personal level, but for all of our viewers and listeners. And I can certainly see why you have such a following here in the Tampa Bay area. And I know you're a very busy woman, but I thank you for joining us and becoming an official member of Bloom Health Club.
Woohoo, excited. Anytime. This was a blast. Thank you.
Awesome. Thank you so much.